Hi, I'm Cody. I'm a pharmacy intern here at Kroger Pharmacy. Today, I'm going to be walking you through how to test your blood glucose levels. Are you aware how to do that?
No, I am not.
Okay, well, I'll show you today. Before we begin, let's go ahead and get all of our supplies ready to test your blood glucose levels.
Okay.
First, you'll need the blood glucose meter, your test strips, your lancet, a cotton swab, an alcohol swab, and a Band-Aid.
Okay.
Do you have any questions about the supplies so far?
No, not yet.
Okay, so before you prick your finger, if you do have poor circulation in your hands or your hands are cold, we do want to warm those, so you can rub them together. You can maybe put them under some warm water if you need to. You can shake them at heart level or even a little bit below to kind of get that blood flowing, so you don't have to end up pricking yourself twice, that you can get the blood out that you need for the test the first time. The next thing we're going to do is get our blood glucose meter ready for the test. As you can see, there is no on and off switch on this blood glucose meter. Fortunately, it does turn on automatically after you insert a test strip. So go ahead and get this test strip out. You will insert the test strip into the blood glucose meter, name up, so facing you, and the plastic side in. Now I'm not going to insert it just yet, but you'll see that when you insert it later on, that it will turn on automatically and walk you through the steps you need. But I'll go ahead and show you the rest of the steps as we go along. Secondly, you'll need to get your finger ready to be tested. So you've already warmed your finger at this point. It's ready to be tested. So let's go ahead. Your handy dandy alcohol pad. You'll open this, clean your finger thoroughly. You do want to test on the side of your finger, so not the pad of your finger and not up under your nail bed, just kind of on the side. And it doesn't really matter what finger you test on. Typically, I would recommend, one of the bigger fingers just because it's going to be a little bit less sore. However, if you are testing every day or multiple times a day, you may want to change fingers up a little bit because, like I said, it doesn't matter what hand or what finger you do test on.
Okay.
So after you've alcohol your finger, you've got that sterile, go ahead and let that dry. You're going to get your lancet ready for use. There is a yellow tab in here that says pull, so you're going to go ahead and pull that out. I didn't do it obviously because I'm not going to test myself. But when you are ready, you'll pull that out and your lancet is ready to use. Then you place the lancet on the side of your finger where you're going to be pricking yourself, and push the white tab here at the end, and that will insert the needle into your finger and give you the blood that you need.
Okay.
When you finish pricking yourself and you have the blood that you need, go ahead and discard of this lancet right away in a sharps container. We don't want anybody else to get pricked with that, and like I said, it does have your blood on it, so we just don't want any cross-contamination. So go ahead and place that in your sharps container. After your blood is coming out, you'll notice that it comes out slowly, depending on you and how you normally bleed, and however that is. You may need to apply some pressure and kind of milk your finger down just a little bit to get enough blood out to test. The blood goes just on the end of the test strip, like I showed you earlier. You will hold the test strip parallel to the blood, so you don't need to scoop it or hold it straight up and down, just straight parallel with the blood, and that will be drawn up into the test strip. At that point, the meter will tell you that the blood is sufficient, and it'll begin reading your blood glucose levels. It takes about 5 seconds with this meter to read it, and it will tell you aloud. It will read your readings aloud.
Okay.
So after you have got that blood on your test, and while it's going ahead and reading it, go ahead and get yourself bandaged up. You can go ahead and wipe that blood off with the alcohol pad. If you have a little bit more bleeding, a cotton swab may be needed. And go ahead and put the Band-Aid on at the end just to stop that bleeding and hold any pressure if you're kind of more of a free bleeder.
Mhm.
I will tell you, so your alcohol pad, your cotton swab, and your Band-Aid after you are done, and your test strip after you've read it and you're done, can just be put into the garbage can
Okay.
as normal. There's no need to insert that into the sharps container like the Lancet.
Okay.
Any questions so far?
No.
Okay. Would you like to try it? Test your own blood glucose and see if you can teach me back what I just taught you?
Yeah.
Okay, let's try that.
All right. So, getting all the supplies together here. First, let's open up the Band-Aid just in case I am a free bleeder. You never know what may happen. Get those together. We will insert the test strip with the name facing me. Get that engaged.
Okay. Yeah, so it's on and it's telling you exactly what you need to do at this point.
Okay. I warmed my hands up and we'll go ahead and clean the finger just in case there are some contaminants on there. And you do take out the yellow part,
Mm-hmm.
and I want it on the side of my finger,
That's correct.
not by the nail and not by the pad of the finger.
That's correct. You don't need to apply too much pressure for a blood glucose reading, but just enough to give yourself a good prick. There you go. Good job.
Let me just milk it here, get enough blood so you don't have to prick yourself twice.
And the meter will begin testing as soon as you get enough blood on there. There's no need to there you go. Okay, and go ahead and take care of that blood. Okay, so your blood glucose reading today is 96 milligrams per deciliter. The American Diabetes Association recommends a blood glucose reading of 80 to 130 milligrams per deciliter. As you can tell, you're kind of right within that range. That's a very good blood glucose reading. The 80 to 135 is at fasting level. So
Okay.
I know you had mentioned earlier that it had been a while since you have eaten.
Yes.
So that is within the range. Anything higher than that is called hyperglycemia. Anything lower than that is called hypoglycemia. If you have chronic hyper or chronic hypoglycemia, that could be an indicator of diabetes, and you would need to talk to your doctor about that and see if you can figure out what's going on at that point.
Okay.
So you've got your Band-Aid on, you're
Yes.
bandaged up. Go ahead and get rid of this Lancet.
Yes, we will put
Where are you putting
this
this?
into the sharps container.
Exactly. And where does everything else go?
This will just go in the garbage like normal.
Exactly. Do you have any questions at this point?
No.
Okay. So if you do have any more questions, go ahead and feel free to give us a call. We're always here. We're always more than willing to help you explain anything further or answer any questions that you may have. But if we don't have any questions today, you're free to go.
Okay. Thank
All right.
you so
Thank
much.
you.